COVID cases are on the rise yet again this summer, but with fewer people getting tested now, scientists are getting creative when it comes to tracking the data. Our Maddie Heimsch has more.
How do you track COVID cases when fewer and fewer are going into the doctor's office to take a test? Well, experts turn to the toilet.
The basic idea is that people that are infected with this virus, whether they have symptoms or not, they will shed that virus in their feces.
Tracking COVID through case reports is becoming less reliable as fewer and fewer COVID patients are heading to the doctor's office to take a test. But there's one thing they are doing.
And so when they flush the toilet, it goes to the wastewater treatment plant. We can take a sample there and it represents, all of the people, all of the toilets that were flushed in that community. So we do think that wastewater has the possibility of being like a weather report for the health in your community.
According to the Wisconsin State Laboratory of Hygiene, 11 of the 45 wastewater monitoring sites around the state are showing significant increases in COVID, and 10 more are showing moderate increases.
We can't look at wastewater data and say wastewater is telling us there's this much, and that is equivalent to exactly this many cases in a community. We're really looking at trends and general levels over time.
The surveillance method is new, only developed in 2020 specifically for COVID purposes, but has since been utilized to track Mpox, influenza, and other respiratory viruses.
It's really telling us something meaningful. So when the clinical data went back down, we know we can rely on wastewater data.
The CDC has a dashboard to view the wastewater data in your community. We have a link to that dashboard up right now on channel3000.com.